As you know, umbilical cord blood cells are the blood of the baby at the time of birth. It would be thrown out otherwise if you don't use it. And baby's blood, of course, comes from a 9 months of time when the baby's growing very, very rapidly. The blood of the baby is filled with stem cells. And these stem cells are capable of doing many jobs, repairing tissues and so on and forth, that we still don't understand very well. Many conditions have now been cured with umbilical cord blood. It is one of the most exciting developments in the so-called regenerative medicine field. Starting about 25 years ago, the first transplants were made in Europe, and 1988 was the first published umbilical cord blood cell transplant, curing a man with a very rare form of genetic anemia, low blood. And it was amazing. 2 years ago, I was at a meeting where this original person who got the first umbilical cord blood unit showed up with all the doctors, and he had his child with him, and he said this child would not be if I didn't survive the transplant. It's now, umbilical cord blood is used to cure diseases like thalassemia, sickle cell anemia. It is absolutely critical for the treatment of leukemia. That's a cancer of the blood-forming cells. It's very important for kids who have inborn errors of genetic errors that prevent them from having an immune system. And this is many kids are born not being able to make antibodies or not being able to make white blood cells. And for these kids, sometimes they call them bubble boys because they have to live inside a bubble separated from the rest of the world. For these kids, umbilical cord blood cells is one of the main therapies today. Well, there are really only two sources of blood that is well vetted, that is where you know it's safe, you know that all the cells are clean and infection-free. One of these are umbilical cord and the other is bone marrow. Now currently, really there's only two choices when they're trying to replace bone marrow. It's either bone marrow or umbilical cord blood. Umbilical cord blood is actually better than bone marrow currently. It engrafts almost as rapidly, but it is safer and produces less complications.